Hi, everyone. Gonna give everybody about another minute or so to join, and then we'll get started. Thanks for being here today. All right, let's go ahead and get going. Hi, everybody. Thank you so much for being here today. My name's Dr. Ashley Caravelli. I serve as a medical director at QC Kinetics. I've recently had the incredible opportunity to lecture at a local medical school and residency program about regenerative medicine. But truthfully, this is the talk that I've been most excited to give because today I get to speak directly with the people who need this information the most. People living with pain, searching for answers, and looking for real solutions that can change their daily lives. Today, we'll explore a topic that has the power to truly transform health and mobility. The title of today's talk is The Truth About Stem Cells and PRP, Hype or Hope? You've probably heard a lot of information, sometimes conflicting or confusing about these treatments. My goal today is to cut through the noise, share facts, and help you understand how regenerative medicine may offer a path to relief and healing without the need for major surgery. A little bit about myself. I am an AVFM board certified physician. I went to Midwestern University, CCOM, where I now serve as an adjunct professor, and I lead a regenerative medicine lecture series for third year medical students. I spent almost a decade in outpatient medicine, seeing the shortcomings of traditional medicine, and I started to transition to regenerative medicine. That's when I found QC Kinetics, where I now serve as the medical director of the Chicagoland clinics. Now that you know a little bit about me, I want to start with something really real. At QC Kinetics, we are blessed to see people who have been in pain for months or sometimes even years, and then I get to watch them regain their lives. These aren't actors or made up stories, they're real patients just like you who wanted another option besides pills, shots, or surgery. Their stories are why I do what I do every day, and I can't wait for you to see the possibilities.
What is it that you exactly do here at QC Kinetics? It's different than traditional healthcare. They are doing something cool and unique here. This is QC Kinetics.
After going through my treatment here, I can go up and down the stairs, no problem. I can go up and down hills. I can sleep, thank you, God. The people here are wonderful. They're pleasant, they're friendly, they're welcoming, and the treatment is literally pain-free.
First time in over 15 years I've not had to take any pain medicine of any sort, and let me tell you, it was amazing.
I'm walking barefoot around the beach. I'm able to do what I need to do for work.
Life before I came to y'all was basically sitting in my chair. I wasn't able to get downstairs very well. I couldn't even walk to my shed, which is only 20 feet from my back door. The pain was incredible, and I have a super high tolerance for pain. And I gotta tell you, this is the best thing I've ever done.
When I first came in, I had a little limp. I'm walking without the limp. There's no pain, and it's just, I feel so much better. My quality of life right now is almost at 100%.
And I swear to God, I have not had any swelling whatsoever. Feeling so much better, and to be honest with you, I don't think I'm going to need a partial knee replacement for a long time.
We want to help you get back to a pain-free life, and at QC Kinetics, we truly believe better starts here.
Now that you've heard some of the stories from our patients, let's step back and let's look at the bigger picture. Joint and muscle conditions affect more than 1.7 billion people around the world. Here in the US alone, over 32 million people live with osteoarthritis, which is the most common joint disorder. The cost of treating these problems, doctor visits, medications, surgeries, adds up to over $300 billion every year. That's actually more than what we spend on cancer and heart disease combined. If you've been living in pain, you are definitely not alone. This is a major health challenge that touches so many families. What are our current treatment options? Traditionally, the options patients are given follow a pretty standard path. Most patients are told to start with medications or physical therapy. The medications can cover up the pain, but they don't fix the underlying cause of the pain. If that doesn't work, then there are injections like cortisone or gel injections. These may offer some short-term relief, but they do not stop the disease from progressing. And repeated cortisone injections can even damage your joints, but we'll talk more about that in a minute. If you still don't get relief or you're told you have bone on bone arthritis, surgery is often presented as the final solution, whether it's a scope, a tissue repair, or even a full joint replacement. The problem is that each of these steps has its limits, and many people feel like they're just being bounced around from one option to the next without lasting relief. Now, I do want to circle back and take a moment to really highlight cortisone or steroid injections in more detail. I suspect many people in the audience today have either had one or know someone who has had one. Cortisone can bring a quick pain relief, but studies show that it can come with its own hidden risks. In fact, a 2019 study published in the Journal of Radiology found that cortisone injections can actually speed up arthritis, break down cartilage, and even weaken the bone tissue. The image shown on this slide demonstrates that fast breakdown and comes from the journal article I just mentioned. Think of steroid injections like a band-aid. It may make you feel better for a little while, but underneath, the problem might actually be getting worse. And just because insurance often covers these injections does not mean that they are the best choice for your long-term health. Sometimes insurance covers what is common and not necessarily what is safest or most effective. That's why at QC Kinetics, we focus on safer, healthier ways to help your joints heal and protect your future mobility. I want to clear up some of the biggest myths I hear all the time about joint pain and regenerative medicine. Myth number one, surgery is the only real solution. That's simply not true. Many patients achieve life-changing relief without ever stepping into an operating room. Our bodies have a natural healing ability, and regenerative medicine taps into that. Myth number two, stem cells are not proven. While research is still advancing and emerging, there are already strong clinical evidence that bone marrow concentrate containing stem cells helps many patients with joint pain and arthritis. And beyond the research, we see these results every day in our clinics. Myth number three, PRP or platelet-rich plasma is just a fad. In reality, PRP has been used for decades. Top athletes, surgeons, and everyday patients rely on it because it reduces inflammation naturally and speeds up healing. This is not a passing trend, it's a well-established treatment. And finally, myth number four, nothing will help me now. I want you to hold on to hope. Even patients who have suffered for years, who thought they were out of options, have experienced remarkable improvements with the right regenerative approach. So the truth is, surgery is not always the answer. These treatments are backed by real science, and there is hope for healing no matter where you are in your journey. And that's exactly what we specialize in at QC Kinetics. Safe, natural, and effective treatments that use your own body's healing power. On this slide, I want to show you something really important, the treatment gap. Many people living with joint pain find themselves stuck in the middle. On one side, you've tried conservative treatments like physical therapy, rest, medications, and those are no longer giving you the relief that you need. On the other side, you may not be ready, or you might not even be a good candidate for a big surgery like a joint replacement. Maybe the surgery just feels too aggressive, or you'd like to delay it as long as possible. That's where regenerative medicine comes in. Think of it as the bridge that connects these two cliffs. At QC Kinetics, we use your body's own natural healing abilities to target the biological processes behind pain and injury. These treatments can help slow down disease progression, reduce inflammation, and improve your function, all without long recovery times of surgery. The best part, our treatments are done in an outpatient setting. You walk in and you walk out the very same day. There's no hospital stays, no major downtime, and no waiting months to get your life back. So instead of feeling like you have to choose between do nothing or have a major surgery, regenerative medicine gives you a powerful third option, one that can help bridge the treatment gap and keep you moving forward. Here's the really exciting part. Your body already has everything it needs to heal. At QC Kinetics, our treatments simply unlock that potential. Think about when you get a small cut. Your body immediately sends platelets to stop the bleeding. Then white blood cells fight off infection, and growth factors trigger new tissue to rebuild the skin. Over time, the wound closes and disappears. Your body heals itself. We use that same principle by concentrating your own blood, plasma, and bone marrow to guide these powerful natural healers right to the areas that hurt. By harnessing your body's healing cells and growth factors, we actively support and boost your natural recovery process. Instead of just masking the pain or covering up your symptoms, we're targeting the root cause, helping your body repair itself from the inside out. Because these are minimally invasive procedures, there's virtually no downtime. And the best part is this: regenerative medicine offers the chance for lasting relief, improving joint health, restoring function, and most importantly, giving you a hope for a future without constant discomfort. Let's talk about something really cool. Your blood has tiny healing tools built right inside of it. With PRP, which stands for platelet-rich plasma, we take those natural healing tools and we make them even stronger. Inside your blood are platelets. On this slide, you can see a very magnified view of a platelet. Most people think about platelets and think they're only for clotting when you get a cut, but they actually do so much more. They're like little factories carrying over 1,000 healing proteins. They also contain growth factors and messengers called cytokines. These signals your body's tissue to tell cells, hey, it's time to calm down inflammation and start repairing. Here's how the PRP works. At QC Kinetics, we take a small sample of your own blood and we spin it in a special machine and concentrate all those powerful platelets and growth factors and cytokines. And then we carefully place them right into the area that hurts, like your knee, your shoulder, or your hip. And the best part, because it's your own blood, it's natural, it's safe, and it works with your body instead of against it. Instead of just covering up pain like medications or steroids do, PRP helps your body actually repair and restore tissue. That means less pain, better movement, a real chance at lasting relief without surgery or long recovery times. Now, I want you to think of your body like a house. Over time, wear and tear, like arthritis or an old injury, can cause cracks and leaks in that house. Normally, your body sends out a repair crew to patch things up, but sometimes that crew is too small or it's too slow to keep up. That's where PRP comes in. Your blood already has the repair workers inside of it. The platelets are like the construction crew carrying the tools. The growth factors are the blueprints showing them what needs fixing. And the cytokines are like the project managers, keeping everyone organized. And here's the key difference. Instead of just painting over the cracks, the way pain medications or cortisone shots do, PRP sends the crew to actually fix the damage. So, what does that mean for you? It means less pain, better function, and more importantly, real hope for a future without constant discomfort. Imagine if your joints had their own personal defense system. That's what concentrated plasma provides. It's packed with powerful proteins already found in your blood that protect your joints and fight inflammation. One of the most important proteins is, and bear with me now, alpha 2 macroglobulin. We'll call it A2M for short. Inside your joints, there are harmful enzymes that act like wrecking balls, breaking down cartilage and worsening your arthritis pain. A2M works like a molecular trap. It catches those destructive enzymes, locks them up, and makes them harmless. Your body then naturally clears them away, like taking out the trash. Here's the exciting part. At QC Kinetics, we can concentrate your plasma to pull out powerful proteins like A2M and also IRAP, which stands for interleukin 1 receptor antagonist protein. IRAP blocks a strong inflammatory signal in your joints called interleukin 1. That's the signal that tells your body to stay swollen, stay painful, and stay inflamed. By blocking it, IRAP helps to calm things down, lower inflammation, and target your cartilage to be protected. So, when we concentrate your plasma, you're getting a natural defense team. A2M is trapping the bad enzymes that eat away at your cartilage, and IRAP is shutting down the pain and inflammation signal. Together, they help to reduce your pain, slow your joint damage, and keep you moving. Now, I think this is the one we might all be waiting for, bone marrow concentrate. So, bone marrow concentrate, or BMC, is one of the most powerful tools we have when your body needs extra healing power. The process starts with a small sample taken from your hip bone. It may sound intimidating, but we use a numbing medication, and many patients handle it very well. Most patients go back to work the very same day. Actually, the other day, I had an elevator mechanic who insisted on working right after his procedure. And when I called him afterwards to see how he was doing, he said he had no issues at work that same day. What makes BMC so unique is that it contains specialized cells called mesenchymal stem cells, or MSCs. These are your body's own stem cells naturally found in bone marrow, and they don't just turn into new tissue like many patients think. Instead, they act more like managers. They calm down inflammation, they protect your healthy cells that you already have, and they send signals that recruit repair cells to the injured area. By doing this, BMC with the mesenchymal stem cells creates the perfect environment for healing. So, for many people with moderate arthritis or tougher injuries, this treatment can be truly life-changing, helping your body tap into its own ability to repair and restore itself. How do you know which one is right for you, PRP or BMC? PRP is often used for milder cases like early arthritis or tendon issues. It's quick, it's easy, and it can be repeated. BMC is stronger and used for more advanced arthritis or complex injuries. Often, we'll combine the two along with concentrated plasma to get the best possible results. At QC Kinetics, we match the treatment to the patient and not the other way around. At QC Kinetics, your safety is always our top priority. One of the ways we protect you is by using autologous therapy. This means we only use products that come directly from you. So we use your own blood or your own bone marrow. That's because your own cells, then there's virtually no risk of rejection or an allergic reaction. Our procedures are minimally invasive. That means there's no big surgical incision, no general anesthesia, and no hospital stays. Most patients walk in, have their treatment, and walk out the very same day. Another large benefit is the low complication rate. Compared to surgery, there's a much lower risk of issues like infection or post-op complications. Patients are really appreciative that they can have peace of mind with a safer, gentler option. And because these are same day procedures, they fit into your life. You don't have to put your whole world on hold. You can get treated and get back to your normal activities quickly. Most importantly, every treatment is performed by a highly trained provider who follows strict protocols that have been refined by caring for thousands of patients across the country. You can feel confident you're in good hands. What conditions can we treat? We treat all kinds of pain. knee arthritis, hip arthritis, rotator cuff tears, plantar fasciitis in the foot, tennis elbow, back pain, carpal tunnel, and more. If it hurts in your joints, tendons, or muscles, there's a very good chance we can help. I know how unsettling the unknown can be, and I want to help provide you with some comfort of knowing what to expect when you come to see us. When you come for your first visit at QC Kinetics, our goal is to really understand you, your pain, and your goals. We'll start with an initial consultation. That means reviewing your medical history, talking through your symptoms, learning what treatments you've tried in the past, and making sure we answer all of your questions and concerns. Next, we'll do a thorough examination. That includes a detailed physical assessment, reviewing any imaging reports you bring with, such as x-rays or MRIs, and running simple movement tests to check for stability, strength, and flexibility. This helps us see not only where the pain is, but how it's affecting your daily life. Finally, we'll put together a personalized treatment plan. Nothing is one size fits all here. We'll explain your options clearly, set realistic expectations, and give you a timeline that makes sense for your condition and your lifestyle. By the end of your first visit, you'll walk away with a clear understanding of what's going on, what we can do to help, and a plan to move you forward towards lasting relief. Here's what treatment looks like. First, we collect a sample of blood or bone marrow. Next, we process it in our in-house state-of-the-art lab. This allows us to pull out all the healing properties we discussed. Then we use the ultrasound to guide the injection so we know it's placed exactly where it needs to go. As you can see on this slide, we're using the ultrasound to look into a shoulder. The ultrasound is essential to guarantee that the treatment is going to the right place. The whole process is typically done in under an hour, and then we get you back to your normal day. Let me ask you this. What would your life look like if pain was not holding you back? For many people, it's being able to walk without stiffness, get back to their favorite sport, play with their grandchildren, or even just enjoy a good night's rest. That's exactly what regenerative medicine is designed to do. Help you move past the limits of joint pain, swelling, and stiffness so that you can get back to living the life you want. You may be a great candidate if you're someone who's tried the usual options, pain medications, cortisone injections, or physical therapy, and still have not found the relief that you deserve. Or maybe you're looking for an alternative to surgery, something natural and non-invasive that taps into your body's natural healing ability. At QC Kinetics, we specialize in exactly that. Our treatments are non-surgical, minimally invasive, and focus on helping your body repair and restore itself. Instead of masking your symptoms, we target the underlying issue to help create lasting relief. And here's the best part. You do not have to figure this out on your own. We offer a free consultation where we take the time to fully understand your symptoms, review your history, and see if regenerative medicine is the right fit for you. So if you've been searching for a real solution, one that helps you reclaim an active, fulfilling life, this may be the path forward. Regenerative medicine can be a wonderful option, but it's not the right fit for everyone. For example, regenerative medicine treatments are not recommended for women who are pregnant or breastfeeding, or for anyone with an active infection. That's because your safety always comes first. What's also important to remember is that these treatments are not a quick fix. They're designed to work gradually, supporting your body's own healing over time for long-lasting results. That's why during your consultation, we'll take a careful look at your medical history and have an open, honest conversation about whether regenerative medicine is a good fit for you. Our goal is to make you feel confident, safe, and supported in your journey forward. At QC Kinetics, we know that choosing the right treatment is a big decision, and we're here to help guide you every step of the way. What sets us apart is the level of care and oversight we provide. First of all, our advanced treatments are physician-led. Our medical management team, made up of experienced doctors, including myself, is dedicated to regenerative medicine, which works to develop, refine, and approve every protocol. Because we are the largest regenerative medicine group in the United States, we are fortunate to partner with leading companies that provide the highest quality biological products. Every treatment you receive is carried out by a qualified provider working under direct medical supervision and oversight from experienced clinicians who have helped treat more than 40,000 regenerative medicine patients. Just as important, we actively collect data and track patient outcomes across our network. This allows us to measure results, improve our protocols, and ensure that every provider is trained to deliver the safest and most effective care possible. Second, we create personalized treatment plans. We take the time to tailor our protocols to your needs, making sure that you get the care that is safe, effective, and designed specifically for your condition. And third, we believe that care does not stop once the procedure is done. That's why we provide a comprehensive follow-up. We monitor your progress, check in regularly, and adjust as needed so that you have the best chance at long-lasting results. At QC Kinetics, it's not just about treating pain, it's about giving you the confidence, support, and trusted medical team walking beside you on your path to lasting relief. Regenerative medicine truly is a journey, one that continues to advance and open new doors for patients looking for lasting relief. Today, we've already have proven options like PRP, concentrated plasma, and bone marrow concentrate, which are backed by strong clinical outcomes and helping people to reduce their pain and regain their function every day. Looking ahead at the near future, treatments are becoming more specialized with targeted formulations designed to address specific conditions with greater precision. We're also seeing exciting emerging therapies where advanced protocols combine multiple biologics to enhance results and create even more powerful outcomes. And of course, the ultimate goal is simple: living without pain. That means helping people return to an active, fulfilling life, whether that's sports, exercise, family time, or just enjoying everyday things without pain. This field continues to evolve, and what makes it so exciting is the balance, embracing innovation while staying grounded in safety and clinical evidence. And that's how we create lasting results patients can truly trust. As we wrap up, let's bring it all together with what regenerative medicine really means for you and your journey to lasting relief. First, there's hope through proven science. Treatments like PRP and bone marrow concentrate are backed by strong clinical evidence and have already helped countless people regain mobility, reduce pain, and return to active living, all without the risks of surgery. Second, this is about gentle healing with powerful results. These therapies are minimally invasive, require no hospital stay, and most patients experience only mild discomfort. That means you walk in, walk out, and start getting back to your normal life quickly without long downtime that comes with traditional surgery. And third, it's about progressive healing and lasting comfort. Improvements build gradually over time, often continuing for months after treatment, and can lead to deep, durable relief that lasts for years, not just a temporary band-aid. At the heart of all of this is one simple truth: you have more potential to heal than you've been led to believe. With regenerative medicine, you can reclaim your freedom from joint pain and step into a future where limitations no longer define you. What's next? If this sounds like what you've been searching for, I encourage you to take the next step. Schedule your free consultation. Just call the number on the screen or scan the QR code to book your visit. We will keep the slide up for a few minutes to make sure that you have the information you need to book. As a thank you for attending this webinar, you'll also receive a complimentary class for laser treatment with your consultation. Simply mention the webinar when you schedule. You've heard the stories, you've learned the facts. Now it's time to see what's possible for you. Thank you so much for your time today, and I look forward to seeing you in one of our clinics soon.